Antoine will show you the results, the economic results, the financial results. But previously, it's the interest to have a doctor. I will stress about a work made with Hubertus Kranz since 2002. And it seems it's the center of our reflection about the future of self-medication. You can find this picture in your leaflet. I don't have this in the bag of the Congress. And it seems to me, for example, in France, I can say to you that we have in this slide 34 indication in this 58 indication. It's a great gap between the actual market and the possible market in terms, not only in financial terms, but also for interest, medical interest, and patient interest. Antoine, it seems to me, it's to you.
Okay. So, in few words, how was built the medico-economic model? Celtifarm tried to explain that to me, so I'm going to try to tell that in simple words. Two things to be kept in mind. Number one, consultation savings per year, plus reimbursement savings per year. That are both of them originated from the change of the drug switches French regulations. And the results are fairly straightforward. Two figures to remember now, 150 million euros and 400 million euros. What is the difference between those two figures? As Professor Baumelou just mentioned, it depends if you look at a restricted number of indication and molecules, or if you look, and that's this case, obviously, 150 million savings per year, or 34 indication and 114 molecules, where then, obviously, the number of savings would be significantly more important. One thing to be kept in mind, those important savings would come mainly from five areas, indications, and you can see them on the right side of the slides. First of all, GRD, gastro, allergic rhinitis, migraine, tryptan, medicine, which are often discussed, nausea, and acute rhinitis. So at this stage, you may have a question, and this question is, in your introduction, Antoine, you presented two figures, 150 and 1.5 billion savings. And here, in the result of the study, you only present 150 and 400 million. So where are gone the 1.1 billion that you mentioned initially? And to answer that challenging question, I hand over again to Professor Baumelou.
It's very difficult to explain, but Antoine is... But the difference can be, the 1.5 is an evaluation of two steps. First, a complete delisting in all convenient indication, a complete delisting of all the molecules. And second option, an increase of the ANSM list, because the ANSM list is very restrictive. In the French tradition, the self-medication is restricted to the acute care of benign medication, and it was during the last years a complete increase of this market. And the second part is to increase the NSM list with probably convenient other indication, which are sometimes authorized in other countries. For example, benign prostatic hypertrophy, chlamydia infection, prevention of cardiovascular risk, more than coronary events, prevention of cardiovascular risk. And for me, an indication, because I'm a nephrologist, acute urinary tract infection in women, because it seems to me it's the best picture of a responsive self-medication, because azithromycin was delisted in Great Britain 10 years ago, but it will be very difficult in France to delist, to make a switch with an antibiotic. The last, finally, the benefit is for the patients. We must have a politic of self-medication centered to the patient, because it seems to me that the manufacturer in this market become a doctor with all the responsibility of information, of follow-up of the pharmacovigilance, continuing information of the pharmacists also, and all the stakeholders are contributing to this interest. And finally, I want to stress, because we are in France in a difficult period with pharmacovigilance, a great problem, mediator. And it seems to me that the change of structure of SAPs in NSM must absolutely conserve the necessity for a specific evaluation of this market. Antoine?
Yeah, thank you. Very brief words of conclusion. If we want to keep in mind 3 things. First of all, French market is a challenging one. Difficult for many reasons discussed. Second point is difficulties and challenges mean a lot of opportunities. Opportunities that will be catalyzed through changes in switches of our current drug environment system. And of course, we are going to have some hard benefits to those switches. That are the economic one, but also soft benefits for patients, doctors, and all the stakeholders, including obviously pharmacists and their specific role of advice to patients. And the third thing to keep in mind, and I would liaise with what Mr. Crispy-Barrère said this morning. I was very, very much impressed, as many of you, I'm sure, by his talk. And what I keep in mind is that the wheel turns, and that we are today, we belong to an industry with a future. A challenging future, but an exciting one. Thank you.
Thank you very much.